Okay, so prior to entering the room, I would make sure that I have an order to place the indwelling catheter, and then I would review the medical records to see if anything will interfere with the procedure. So I'd look at the list of diagnoses and her allergies. I would assemble all my appropriate equipment out here, and then I would knock prior to entering. So then first, I would acknowledge the patient and introduce myself. Hi, Sally Smith, my name's Shannon, I'll be your nurse today. I have an order to insert a catheter. It'll take up to 15 minutes, but we'll do the best we can to get this done, okay? It can be a little uncomfortable. So then I would verify, I'd perform hand hygiene. I'd verify her name and date of birth on her wristband, or I could ask the patient as well. So then you'll get started. So I want to first move the patient up to a good working height. And then we want to make sure they're also in a comfortable position. They're usually lying down. And then I would put some gloves on. And we're going to palpate the bladder for distension. And we also want to make sure that we provide privacy at all times. Like that. And we'll go ahead and lift the gown up and just palpate the bladder area. Okay. So then after, we would perform perineal care. So if they're incontinent, we would make sure that we change their briefs. That was the case. So we'll do that next. And I also, after perineal care, we would make sure that there's a waterproof sheet underneath and provide privacy again. Okay, so then I would get rid of these gloves, perform hand hygiene again, and then we'll go ahead and unwrap the catheter kit. So let's see. And then you want to make an area for the trash. And then I would position the patient in the dorsal recumbent position, which is where their knees are slightly bent and they spread their legs a little bit apart. And then we'll just kind of keep her covered while we prepare this. Probably gonna transfer this over there before unwrapping. But you want to make sure you don't touch the inside of that. And then let's see, take the gloves out. Make sure this is moved up. We'll wear our sterile gloves. This has been opened before. We did check to make sure that she doesn't have a latex allergy. Okay, so we're sterile. We want to make sure that we don't have our hands underneath our waist. We'll unwrap this drape next with the shiny side facing down. And that gets tucked in between the thighs. We do have the option to use this drape that goes over the labial area. but we'll leave that out for now. Let's put that in the trash. Next, I will take this tray out, and we'll go ahead and take the tubing out. So I would put my lubricant here, dispose of that, and then I would tear these iodine swabs open. We'll use 3 swabs total. Using my non-dominant hand, we would open the labial area, cleanse the outsides, and then the insides, front to back, and then dispose of all of these, keep it out of the sterile field. So now I'll have you bear down for me whenever we insert the tube, okay? So we'll take off the wrapper here. And we would apply the lubricant, and you'll want to hold it to where it's at least 5 centimeters away from that, and then so it's lubricated, and we'll insert it. But first, some manufacturers require you to inflate the balloon prior to inserting, just to make sure that it works. You take the cap off carefully, get rid of that. Okay, so now we're going to insert the tube. And I'm going to make sure it goes into the urethra. This one's hard to insert into. And once we see urine, we would stop, and then we would then inflate the balloon. So I would inflate that, and I also want to note how much we inflate into the balloon, how much fluid we use. And then afterwards, we want to make sure that we feel resistance when we tug, so to make sure that the balloon is in the bladder. So once we feel resistance, that means we can stop, and we can actually further insert another 2 to 5 centimeters into the urethra. Okay, so after I will, take off the sterile gloves, and I want to make sure that this is secure. I'd hold on to this while I secure this to her thigh. Sometimes you could have an assistant in the room with you, and they could help attach that. And I'll go ahead and provide privacy for a patient here. I'll take off my sterile gloves, dispose of all the equipment that was used. But first, let me re-glove. Okay, so this is trash. I'll go ahead and perform hand hygiene again, and then I would put on some new gloves here. I want to make sure that the port is closed, and that would have been done as I was inserting and stuff to make sure that urine doesn't come out. Then I would check to make sure that there isn't any obstruction in the tube. So you want to make sure that this doesn't wrap around their leg. And afterwards, I would make sure that we attach the urine bag below the bladder to a non-movable part of the bed. And I would also measure any output, and we would dispose of all of this. We would take a catheter wrap, and that would be used here to secure the area. And we'll dispose of all of the equipment used. So this would be in the trash. We would remove the waterproof pad, and then we would make sure that we need to take that out too. And then afterwards, we want to make sure she's comfortable. Provide privacy again. Give her her personal belongings if she needs them close by. Make sure the call light is within reach. And then afterwards, I would lower the bed to the lowest setting. Thank you for letting me take care of you today. Is there anything else that I can get for you? And you want to make sure they're comfortable. Take my gloves off. I'd perform hand hygiene again. And then afterwards, I would document the procedure that we performed. I'd write down the time, date, how well they tolerated the procedure, the size of cath that we used. I'd also record the urine output, the measurements of the cath, or I think I already said that. The urine output, the measurements and characteristics of the urine, so like color, amount. And then next, I would document the amount of fluid that was used to inflate the balloon, any complications that occurred during the procedure, and then I would educate my patient on the catheter. And that concludes my video. Thank you.